Hello, my name is Evan White, and today I will be giving my final presentation for my Pathophysiology course. Today is December 20th, 2025. I will be giving a presentation on a disease. The disease I have selected for this presentation is acute appendicitis. Acute appendicitis is defined as inflammation of the appendix. Depending on the tissue involved with the inflammatory process, appendicitis can be classified in one of three ways. If neutrophils invade the appendix and interact with the mucosal layer and start to cause inflammation from that point, is suppurative appendicitis. If there's necrosis of the walls of the appendix, then it is counted as gangrenous appendicitis. And if it is involvement of the serosal or subserosal layers around the appendix, that variant of appendicitis is called periappendicitis. All three of these are generally treated in a very similar way, where one of the go-to treatments is an appendectomy, the removal of the appendix. The etiology for appendicitis is typically a blockage around the appendix. This could be a fecal impactation. This could be a tumor or hypertrophy of the lymphatic tissue around the appendix. And acute appendicitis falls under the syndrome of acute inflammation of the abdomen syndrome. The clinical manifestation for appendicitis, the signs and symptoms typically manifest within 24 hours of onset of the disease. Following the obstruction of the appendix, it can lead to either the body's immune system causing inflammation localized to the appendix, or it can cause a change in the microbiome of the anaerobic and aerobic bacteria within the appendix. And this will manifest as pain in the lower right quadrant of the abdomen. This is very characteristic of and distinguishing of acute appendicitis. There's going to be pain and rebound tenderness in the area of about the pad of your thumb in that lower right quadrant. The pain can radiate out from there, but is going to be very specifically along a small area, which can help it stand out during physical examination from other inflammatory processes of the abdomen. Some other signs and symptoms for acute appendicitis can include anorexia, a lack of desire to eat, nausea with or without vomiting. You can also experience diarrhea, fever, and other associated signs and symptoms with a bacterial infection, such as tachycardia, tachypnea, or hypotension. There's a few different tests you can use when trying to determine if a patient has appendicitis as opposed to another um, inflammatory process within the abdomen. Uh, One of the go-to diagnostic tests when determining appendicitis is oftentimes getting a clear history and doing a good physical examination of the patient. You want to try to investigate if they have any known diseases or other um, complications with their abdomen or gut health. If they have any kind of history of like colitis or irritable bowel syndrome, you want to see the onset of symptoms are within about 24 hours. And the severity is going to be intense, and that is isolated to the lower right quadrant as opposed to another aspect of the abdomen. For a more definitive way of determining if a patient has appendicitis, you could do visual tests such as ultrasonography or a CT scan, so you can visualize the tissue itself and see whether or not the appendix is enlarged or swollen. Um, a third test you could do, which is not present, is not a positive indicator in every instance of appendicitis, is a blood serum test where you're looking at the leukocyte count or the C-reactive protein in serum levels. If there's bacteria present from the appendicitis, you would expect both of those to be elevated. But there's not always a bacterial infection associated with appendicitis, so sometimes that test will be negative and the patient may still have appendicitis. One differential diagnosis for appendicitis would be gastroenteritis. Gastroenteritis is a bacterial or viral infection of the lining of the wall of the intestine. It presents with a very similar clinical manifestation: quick onset pain within 24 hours, nausea, anorexia, diarrhea, fever, other signs of infection, like, again, tachycardia, tachypnea, hypotension. But gastroenteritis can occur anywhere in the intestines as opposed to isolated to the lower right quadrant, and is typically going to affect a wider area of tissue as opposed to that thumb pad sized area of tenderness that is trademark of acute appendicitis. One way you could differentiate between gastroenteritis and appendicitis in a more definitive manner would be something like a CT test, where you can take a look at the structures within the abdomen and identify which structures are inflamed, which structures are swollen. And that would be able to show you whether or not it is truly the appendix that is causing the patient's clinical manifestation and symptoms. There's a few different possible complications for appendicitis, whether it's treated or untreated. Firstly, there is peritonitis, which is inflammation of the serous membrane of the abdominal cavity, the peritoneum. You could also get a abscess formation along the appendix or the surrounding tissue of the appendix due to the appendicitis, which can cause very similar symptoms yet again. You can also get septicemia, which is bacterial presence in the blood. And that can happen whether or not there's a perforation or bacteria is just leaking from that environment into the bloodstream as the body's trying to deal with the appendicitis. One final complication, this is not an exhaustive list, but one more complication of appendicitis is the risk of perforation if left untreated. During perforation of the appendix, there is a rupture of the wall of the membranes around the appendix, and this can cause a leaking of bacteria into the peritoneal space, which can further spread infection, bacteria, and trigger more inflammation. And that is my presentation. Thank you very much. You can find my sources in the description.